Nick, thank you. As athletes prepare to be center stage in Tokyo this month, one American is staying home even after great results at the Olympic trials. Sha'Carri Richardson is currently on a 30-day suspension following a positive drug test for using marijuana. New tonight, our Noah Kaplan spoke with a Mayo Clinic doctor today about if cannabis should be a banned substance for athletes. And Noah, what did you find out?
Well, Zach, one of the major questions stemming from Richardson's disqualification from the Tokyo Olympics is as follows. Does marijuana usage actually affect athletic ability? But opinions from community leaders and health practitioners seem to be mixed and divided.
There was some thought that perhaps the sort of relaxation or sedative effects that have been attributed to marijuana could improve performance in a sport like shooting or archery. But again, no evidence in an explosive sport like sprinting that it would do anybody any good at all.
Sha'Carri Richardson is now sidelined from Olympic competition due to a failed drug test at the Olympic trials, admitting to using cannabis. Though marijuana is included on the list of banned substances, there is now a question of if it enhances performance.
Does it make people faster? Does it help them jump higher? Does it make them stronger, or do any of the or affect any of the components that affect those properties? There's no evidence really in the reputable medical literature that cannabis can improve athletic performance.
Dr. Joyner with the Mayo Clinic says the rapidly changing perception and legality behind cannabis is causing confusion.
The WADA code has not necessarily caught up with some of the societal changes related to marijuana use, which have really changed dramatically in the last 5-10 years. A person who knew the rules got caught up in the rules, and the rules really had not adapted to the changing circumstances.
State Senator Carla Nelson would agree changes are happening too quickly.
Until there is a field test for sobriety, for influence, for having that THC in the system, then I think it is not a safe public safety measure.
Not have an official stance or statement, but it says it supported the autonomy of private organizations such as the World Anti-Doping Agency, saying in part, quote, Republicans generally do support the rights of individuals and groups. This includes the right of private groups to set their own standards for membership and policy. And Richardson has come out and admitted to using marijuana, saying she used the drug to cope after her biological mother had passed away, and that she was aware of the rules. Dr. Joyner pointed out that this is also an opportunity to shine a light on mental health. Back to you.